Every year, surgeons perform over 310 million major operations worldwide. That's roughly one surgery for every 25 people alive. You've probably had one. You'll probably have another. And yet almost nobody actually knows what happens once the anesthesia kicks in and the lights go out. This is every surgery explained. Appendectomy. The appendix is a small, worm-shaped tube hanging off your large intestine that has no confirmed purpose and approximately one confirmed talent: exploding. When it gets infected, it inflates, then it ruptures, and when it ruptures it dumps fecal bacteria directly into your abdominal cavity. The clock from first symptom to life-threatening peritonitis is roughly 72 hours. Surgeons have been removing appendixes since 1735. The first patient survived. The surgeon's assistant did not. He died of infection after being accidentally cut during the procedure. That is how medicine started. Today the operation takes about 30 minutes. 3 small incisions, a camera, a stapler. The appendix gets clipped at the base, detached and pulled out through a hole the size of a finger. You wake up confused, eat a cracker and go home the same day. The entire organ is placed in a container and sent to pathology where someone confirms it was, in fact, destroying you. Here's what nobody tells you. About 1 in 20 appendectomies are performed on a perfectly healthy appendix. The imaging is inconclusive, the pain fits the profile, and surgeons make a judgment call. They remove it anyway. The appendix is gone. You're fine. The actual problem, sometimes an ovarian cyst, sometimes gas, sometimes nothing they ever identify, resolves on its own. You now have a scar and a story. Globally, appendicitis affects about 8% of the population over a lifetime. Right now, approximately 300,000 Americans per year are having this surgery. Most of them thought it was just a stomachache. Cesarean section. The most performed major surgery on Earth is also the one with the most mythology attached to it. Julius Caesar was not born by C-section. His mother lived into his adulthood. Before the 20th century, a cesarean was essentially a death sentence for the mother. The name likely comes from the Latin caetera, to cut. The operation exists because human heads are enormous relative to human hips, a design flaw that evolution has been failing to fix for 200,000 years. The anesthesiologist numbs everything from your chest down. A horizontal incision goes through skin, fat, and fascia. The abdominal muscles aren't cut, they're pulled apart by hand. The uterus is opened. A human is removed. The whole extraction takes about 2 minutes. The next 45 minutes are spent closing everything back up in layers, which is the part nobody films. Here's what nobody mentions. A C-section is classified as major abdominal surgery, but in most hospital systems it's treated logistically like a minor procedure. Women are often discharged in 3 to 4 days and expected to care for a newborn while their uterus heals from an incision. The recovery is 6 weeks minimum. The internal scar tissue can cause complications in every subsequent pregnancy. About 21% of all births worldwide are now cesarean. In some private Brazilian hospitals, that number exceeds 80%. Not because 80% of births are emergencies. Because scheduling is convenient and liability is lower. 1 in 3 American babies is born this way. Most people have no idea what actually happened in that room. Coronary bypass. Your heart is a pump the size of your fist that beats 100,000 times a day without being asked. Eventually, the arteries feeding it get clogged, cholesterol, inflammation, decades of bad Tuesdays. When they narrow enough, the heart starts suffocating from the inside. A bypass surgery reroutes blood around the blockage using a vein stolen from somewhere else in your body, usually your leg. The surgeon cuts open your chest, saws through the sternum with a tool that sounds exactly like what it is, and spreads your rib cage apart with a retractor. Your heart is then stopped. Completely stopped. A machine takes over, pumping and oxygenating your blood while your heart sits motionless in your chest. The surgeon works in silence on a still organ. The vein graft is sewn in with sutures finer than human hair. Here's the part nobody tells you. The moment the heart is restarted, it doesn't always cooperate. Sometimes it fibrillates, quivering uselessly instead of beating. A shock is delivered. It usually works. The chest is wired shut with stainless steel that stays in your body permanently. Airport metal detectors will not go off. The wires are too small. But they are there, holding your sternum together for the rest of your life. Coronary bypass has a 98% survival rate in low-risk patients. Recovery takes 3 months. Every year, about 800,000 of these surgeries are performed globally. The leading cause of needing one is the same thing it's always been: time, fat, and stress. Lobotomy. This one is no longer performed. That sentence should reassure you. It does not. The prefrontal lobotomy was invented in 1935 by a Portuguese neurologist named Egas Moniz, who won the Nobel Prize for it in 1949. The procedure involved drilling holes in the skull and destroying connections between the prefrontal cortex and the rest of the brain. The stated goal was to calm psychiatric patients. The actual result was frequently the permanent destruction of personality, memory, and volition. American physician Walter Freeman later refined it into the transorbital lobotomy, which required no drilling at all. He inserted a metal pick, resembling an ice pick, through the eye socket above the eyeball, tapped it through the thin bone into the brain with a small mallet, and swept it back and forth. The whole procedure took 10 minutes. Freeman performed it in his office. He did not always use anesthesia. He toured the United States in a van he called the Lobotomobile, performing the procedure in state hospitals across the country. He lobotomized over 3,000 people. Here's what nobody mentions. The patients who were considered successes were the ones who stopped being disruptive. Stopped complaining. Stopped resisting. They weren't healed, they were quieted. Many became incontinent, apathetic, and childlike. Rosemary Kennedy, sister of JFK, was lobotomized at 23 because her family found her moods inconvenient. She spent the remaining 63 years of her life in a care facility, unable to speak properly or care for herself. The procedure was abandoned in the 1970s not because of ethics, but because antipsychotic drugs were cheaper and easier to administer. The Nobel Prize given for inventing it has never been revoked. Bariatric surgery. Obesity has a BMI threshold, a public health crisis designation, and approximately 500 years of moral judgment baked into the way people talk about it. Bariatric surgery cuts through all of that, sometimes literally. The gastric bypass divides your stomach into a pouch the size of an egg and reroutes your small intestine to connect directly to it. You eat 3 tablespoons of food and you're full. You stay full. Your hormonal hunger signals are altered permanently. This is not willpower. This is plumbing. The surgery takes 2 to 4 hours under general anesthesia. 5 small incisions. The stomach is stapled and divided. The intestine is cut and reattached. The bypass section of gut doesn't disappear. It's left in place, just disconnected from the food supply. It continues producing digestive enzymes into the void. Here's the part nobody tells you. Bariatric surgery doesn't just change your stomach. It changes your brain. Within days of surgery, before significant weight loss has occurred, type 2 diabetes goes into remission in up to 80% of patients. Researchers still don't fully understand why. The current theory involves changes in gut hormones and bile acid signaling that affect insulin sensitivity directly. The surgery appears to reset metabolic set points that dieting cannot touch. It's not a stomach operation. It's a metabolic intervention that happens to involve the stomach. Over 250,000 bariatric surgeries are performed annually in the United States. The long-term success rate is roughly 50% for sustained weight loss, not because the surgery fails, but because the food environment doesn't change. Face transplant. In 2005, a French woman named Isabelle Denoyer was mauled by her dog while unconscious and lost her nose, lips, and chin. Surgeons transplanted a partial face from a brain-dead donor. She became the first person in recorded history to walk around with another person's face. She was not the last. A full face transplant involves detaching the donor face, skin, fat, muscles, nerves, sometimes bone, and attaching it to the recipient's skull using microsurgery. Arteries and veins are reconnected under a microscope using sutures thinner than a strand of hair. The surgery takes 20 to 30 hours. There are currently fewer than 50 recorded face transplants in history. Each one is functionally a new surgical frontier. Here's what nobody tells you. The recipient does not look like the donor. They don't look like themselves either. The underlying bone structure is the patient's own. The transplanted tissue drapes over a different skull. The result is a third face. A composite. Something that has never existed before. Patients must take immunosuppressant drugs for the rest of their lives to prevent rejection, which means trading a functioning immune system for a functioning face. Several recipients have died, not from surgical failure, but from infections their suppressed immune systems couldn't fight. As of 2024, Isabel Denoire was not among the survivors. She died in 2016, 11 years after the transplant. The cause was complications from long-term immunosuppression. Medicine gave her a face. Then it had to choose between the face and the rest of her. That's 6 surgeries, 2 you've probably had, 2 you know someone who has, 1 that should never have existed, and 1 that rewrites what a human face means. Surgery is civilization's most dramatic admission that the body can fail, and our most arrogant insistence on fixing it anyway. The knife has been the last resort for 4,000 years. And somehow, improbably, it usually works.